panel continues.
We want to welcome Independent Senator Bernie Sanders of Vermont. Good morning. Thanks very much for being with us.
Thank you.
Your single-payer plan, how would it work?
Well, what it does is it begins to deal with the major problems that exist in our current healthcare system. Everybody, I think, understands that our current system is disintegrating. We have 46 million people without any health insurance. We have more who are underinsured. And at the end of the day, we end up spending, despite those results, far more money per capita, almost twice as much as any other country. And our healthcare outcomes, how we do in infant mortality, longevity, disease prevention, is not as good as many other countries. Now, why is that? The reason, to my mind, largely has to do with the fact that our system is geared toward making money for the private health insurance companies. And I don't want to shock any of the viewers, but the function of a private health insurance company is not to provide quality health care to all people in a cost-effective way. It is to make as much money as they possibly can. And when you have that paradigm, if that's what the goal of the system is, you end up not only with 1,300 separate private health insurance companies, but you end up with thousands of different benefit packages which cost an enormous amount of money to administer. So the bottom line is we are the most, not only the most expensive, but the most bureaucratic and wasteful system in the world, because we are spending hundreds and hundreds of billions of dollars in administration, in profiteering for the insurance companies whose profits have been doing very, very well, in giving exorbitant compensation packages to CEOs. A couple of years ago, a fellow who was the head of United Health got $1.6 billion in stock options, et cetera, et cetera. So the goal of healthcare should be to provide the best quality healthcare to all of our people in the most cost-effective way. And to my mind, the way you do that, and what we have learned from other countries around the world, is that a single-payer system would work.
Let me read to you. This is from David Gratzer. He is a physician from Canada. He had penned this editorial this morning in the Wall Street Journal called Canada's Obamacare Precedent. He also talks about the situation in the United Kingdom. But he concludes with this question, quote, why are they rushing into a system of government-dominated healthcare when the very countries that have experienced it for so long are backing away?
Well, first of all, I don't know that that's accurate. The truth of the matter is we are the only country in the industrialized world not to have a national health care program. So we are the odd guys out. Second of all, if you compare the American system to Canada, it is true Canada has problems. So do we. But we spend almost twice as much per person as the Canadians do. And if we spent that kind of money, continue to spend that kind of money, $2.3 trillion, 18% of our GDP, we could have a better system than the Canadians. I think the correct question to ask is, how does it happen that every other country, major country on earth, says, A, healthcare is a right of all people. We don't do that. And second of all, they end up coming up with a much more cost-effective approach. And three, their outcomes, in many cases, infant mortality, life expectancy, preventable deaths, are better than we do. I think the evidence is overwhelming. Our current system is not working, and we have to move in a very, very different direction. We have to have the courage to take on the private insurance companies who spend hundreds of millions of dollars in lobbying, campaign contributions, the drug companies who charge us the highest prices in the world, and also have a very powerful lobbying force here in D.C.
Can you clear something up? Because there's been a lot of discussion in this town over the single-payer plan and what Senator Baucus, the chairman of the Senate Finance Committee, will and won't put on the table. Is it on the table?
No. Well, what Baucus did is I arranged for a meeting between a number of physicians and nurse organizations with Baucus. And I think what he said is, months ago, he said single payer is not on the table. And what he indicated to us that he regretted saying that he should have held a hearing, he should have listened to him, and he apologized in a sense for that. But the truth of the matter is, in my view, I speak only for myself now, the power of the insurance companies who make so much money out of our current health system and the drug companies is just so strong that it's very hard for us to get the kind of hearing and the kind of success that we need to move toward a single-payer system.
So you're saying special interests are influencing the debate?
Influencing the debate? No. I think special interests own the debate. I mean, I don't want to shock you, but in fact, these guys have spent hundreds and hundreds and hundreds of millions of dollars to make sure we do not have a cost-effective, comprehensive, universal healthcare system that guarantees healthcare to all people.
So what does that tell the person out there that doesn't have insurance and wondering what's going to happen next.
Well, it tells them there's a lot of debate, and after I leave this interview in a couple of hours, I'll be meeting with the HELP Committee, Health Education Labor Committee, of which I'm a member. We're going to be talking about things. And we don't know what the end result will be. It is possible we will make some progress in terms of primary health care, in terms of disease prevention, in terms of making health care more affordable to people who today don't have any health insurance. But my concern is, look, is that we're going to be pouring huge amounts of money into a system which is largely dysfunctional. And that means it's like a leaky bucket. You keep pouring water into it. You can have some good success in keeping water in the bucket, but you have to keep putting more and more into it rather than understanding why the system is so wasteful and inefficient. In California, my understanding is that about 1 out of 3 healthcare dollars goes not to doctors, not to nurses, not to medicine, not to making us well or keeping us from getting sick. It goes to administration. And that is basically the crux of the problem right now. Our system is designed to make money for the drug companies and the insurance companies, not to provide quality health care to all people. And I think we've got to change direction in a very substantive way.
One of the leading debaters on the issue of health care is the subject of a piece this morning in the Washington Post by Paul Kane. On the cusp of historic majority, Senate Democrats missed the pillars. Also, a reference to Senator Robert Byrd, who's 91 years old, but Senator Kennedy, who's battling brain cancer. And there's a quote from your colleague Mitch McConnell in the piece saying it's hard to imagine a Senate without them. Also, a story this morning inside the New York Times and a quote from Senator Jack Reed of Rhode Island saying that I think we would all like to see Senator Kennedy here for many, many reasons, but we're going to move forward without him. Will he be at all part of this debate?
I don't know. We heard him, he was part of a telephone conference call a week ago, and he sounded good. We're going to be meeting today. My understanding is probably not going to be there, and I think Chris Dodd is kind of picking up the leadership of the committee. The other point that I want to make when we talk about health care, it's not just a personal issue with people uninsured, underinsured, or paying close to $8,000 is what we're paying per person right now, which is unsustainable. It's an economic issue. And everyone's talking about General Motors going bankrupt. Well, General Motors today spends more money per automobile on health care than they do on steel. And in my state of Vermont and all over this country, small businesses just cannot afford to put more money into escalating health care costs when they would like to reinvest in their business and create jobs and make some money. So we have, as the president appropriately points out, not just a crisis at the individual level, it is a major economic crisis that we have got to address, and that's why we need real health care reform.
John Webster, who agrees with you, is sending in this tweet saying, regrettably, our doctors and insurance companies are thieves. We need national health care like other developed countries.
Well, let me also say this. You know, the concept of single payer is not some fringy idea. You have 15,000 physicians in this country, 15,000 who support a single payer system. You have the largest nurses organizations in this country that support single payer. And you know why? They are sick and tired of being told what to do by the private insurance companies. There was a study came out a few weeks ago where doctors are spending between 2 and 3 weeks just arguing with insurance companies about the kind of therapy that they can prescribe. Nurses are doing the same thing. People go into medicine and they go into nursing. They want to practice their profession. They want to work with people, not scream at insurance companies, which prevents them from doing what they were trained to do.
Senator Bernie Sanders is our guest. JR is joining us on the phone from Kansas City. Good morning.
I have a few things I'd like to talk about if I could. You know, watching C-SPAN, we found out that in Canada they have a 10-year patent rights on their medicine. In America, we have a 20-year patent right. Why is it that our Congress hasn't done something about that? To give these pharmaceutical companies the right to charge as much as they can for medicine for 20 years, it takes away from anything we could possibly do. And then the other thing is, I have a nephew that just became a chiropractor. I was talking to him. His education has cost him more than $250,000 before he ever gets a chance to work as a chiropractor.
Let me answer 2 questions, because I live an hour away in Vermont from the Canadian border. I was the first member of the United States Congress when I was in the House to take Americans over the Canadian border to purchase prescription drugs in Montreal. And I'll never forget, as long as I live, the expression on the face of women. Many of those who were with me were struggling with breast cancer. And they bought a drug at that point, this is a number of years ago, called tamoxifen, which is used for breast cancer. They paid 1/10 the price, 1/10 the price in Canada for the same exact medicine that they were buying in the United States. And I should tell the caller that right now, many of us are fighting for a program we call a reimportation of medicine so that Americans do not continue to get ripped off by the drug companies and have to pay the highest prices in the world. In terms of education, again, one of the problems that we have is that many people who graduate medical school today are very, very deeply in debt. In the University of Vermont Medical School, for example, it's about $150,000. If you go to dental school, it's even more. What we are trying to do and have succeeded doing in the stimulus package is greatly expand a program called the National Health Service Corps, which provides debt forgiveness for those doctors and dentists who work in medically underserved areas. We need to get more doctors out into the areas where people need them for primary health care, more nurses out there, more dentists out there. We're making some success in that, but we have a long way to go. But the cost of medical education now is such that the average person graduates $150,000 in debt. They're going to go to become a specialist in order to make the kinds of money they need to pay off that debt, and that's a real problem.
Our guest, Bernie Sanders, the former mayor of Burlington, former member of the House in his first term in the U.S. Senate. Patrick is on the phone from Atlanta. Good morning.
Good morning. Senator Sanders, I just wanted to thank you for your honesty and your service. You always talk truth, and you always, there's never any special interest money behind your campaigns. You always represent the people, and I just wanted to thank you for your service, sir. My question is what are we going to do against the insurance companies when the bill is going through the Congress and they try to strangle it the same way they did in '94 with Hillary Care?
Well, let's be clear where we are right now. Forget single payer for the moment. To the best of my knowledge, there is no Republican, not one, that wants a public plan, a strong, at the very least, a Medicare plan for all Americans. And you have some conservative Democrats who are also wavering on that issue. I think what we need is, to answer Patrick's question, just a very strong grassroots movement which says that health care in America must be a right of all people, that it doesn't make any sense that a working person who may work at a company that doesn't provide good quality health care can go bankrupt if they end up in the hospital while somebody else has good care. It doesn't make any sense that we spend almost twice as much as any other country on health care. Health care has got to be a human right for all people. And we need to mobilize in the same way, Patrick, that we dealt with civil rights. That was a struggle that went on for decades, that we dealt with women's rights, that we dealt with other fundamental injustices in America. This is a civil rights issue of our time. It is wrong that families are going bankrupt. It is wrong that families, because they can't afford health care, it is wrong, in my view, that millions of people, we have 60 million people in America today who do not have a doctor of their own. And we have almost 20,000 people who die every year from diseases which were preventable because they never went to the doctor. That's over 6 times every single year the people we lost on 9/11. This is a moral issue. It is a civil rights issue. And our position must be health care for all people, quality health care regardless of income. And we can do that, in my view, if we take on the private insurance companies and the drug companies without spending any more than the amount of money that we're spending today. That's the struggle we're in right now.
Andy Rosenberg, who's a Democratic lobbyist, he works for Ogilvy Government Associations, and this piece this morning from David Drucker in Roll Call. He's quoted as saying this: a potential challenge looms for the Washington leadership of these trade associations, with reference to healthcare-related associations. How do they maintain their relationships and commitment to a process, and what happens if, when the details come out, their membership is not convinced that the process is worth participating in?
Don't get it.
Well, he's talking about the role of lobbyists in this whole process.
Well, I'm not sitting around here worrying about lobbyists. I mean, lobbyists are the bloody problem. Mm-hmm. Whenever you take on, getting back to the question about prescription drugs, we pay by far the highest prices in the world for prescription drugs. The pharmaceutical industry over a period of years has spent hundreds of millions of dollars lobbying Congress, huge amounts of money of campaign contributions, advertising. They never lose. They have never, ever lost in a battle with Congress. So I don't sit around worrying about the lobbying. We've got too many lobbyists here. And they're former leaders of the Republican Party, Democratic Party, these guys making hundreds of thousands of dollars a year representing big money interests. I think maybe we need a little bit more energy for ordinary people, for the middle class, for working people. So,
well, and this goes along your lines, because the essence of the story from David Drucker is that Republican allies are mounting a public relations offensive to put the brakes on President Obama's overall health care plans.
Of course they are. Their job is to represent the insurance companies, to make sure that CEOs can make tens of millions of dollars a year. Their companies are very, very profitable, and they could care less that millions of Americans are paying far more than they can afford. We're spending about $7,800 per person on health care. Can you imagine that? What does a family that makes $30,000 a year do? You can't afford that anymore, and it's going up and up and up. 46 million without any health insurance, and these guys are worried about the profits of the insurance companies. I mean, that is just an outrage, and we have to have the courage to stand up to them.
From the Republican line, Eddie is on the phone from Savannah, Georgia. Good morning.
Good morning. Good morning, Senator Saunders.
Good morning, Eddie.
The information or the conversation that you're having, majority of it is true. The previous representative from Georgia was not telling the truth as it relates to the insurance information. I have 3 insurance policies. One, I'm a retiree, and one is through my job, which I contribute. One is through my husband, which he pays nothing, and that is because his was through a union. He pays something. He pays through union dues and what have you. And the other is Medicare. I am still paying through the nose for my share of health coverage. I have 2 types of drug coverage, one through my own personal, through my retirement plan that I had, before, and one through my husband. I have a chronic illness and with my drug company, I pay $10. No, $20, $20-something. Through my husband, the same medication costs me $10. And, they are in cahoots.
Well, I think here's the point. Healthcare is expensive. Any system in the world is expensive. But it makes no sense for us to be spending an estimated $350 or $400 billion a year in wasteful administrative cost. We have an enormously complicated system. All of us will remember during the campaign, I happen to think it's one of the reasons that Barack Obama won the election. He was talking about his mother, who was dying of cancer, trying to summon up her energy to be strong, having to fight with the insurance company for coverage. And all over America, that is what is going on. Here's a story. In the last 30 years, we have seen 25 times more jobs created for healthcare bureaucrats who argue with us about whether or not we're covered than we have seen in the increase of physicians. We need more doctors, especially primary care. We need more dentists. We need more nurses. We're not getting that. You know what we are paying for? Through the nose, we're paying for healthcare bureaucrats who are out there arguing with us about whether or not we're covered. We have an enormously complicated system. So the way you save money is to come up with a simple system. Frankly, no system is perfect. But at the end of the day, you say, you know what? You're an American. You're going to have all of the health care that you need. It's going to be paid for out of the public system. It's going to be paid for out of taxes. You're not going to be paying private health insurance. You're not going to be having 16 different programs there. Everybody is going to get the same quality health care. And if we move in that direction, we save hundreds of billions of dollars in administration. We put that into coverage for all Americans. And I think we have the best system in the world.
Jim had sent in this tweet, Senator Sanders, why not propose a bill to ban insurance companies? That seems to be your goal, to put them out of business.
It is my goal, and we have introduced that legislation. It's called the single payer.
Garrison is next from the state of Wisconsin. Good morning.
Good morning. Senator, thank you very much for the fight you're putting on. I'm 70 years old, retired, and have just had 3 major surgeries, 2 heart surgeries, and prostate cancer surgery. My wife has been forced out of having health insurance, and we are at the brink of bankruptcy. I fought very hard to get President Obama elected, and I am become very bitter and very disillusioned when you have somebody like Senator Baucus, who won't give single-payer people a seat at the table, and he's taking hundreds of thousands of dollars in contributions from the people that are creating the situation we have in this country. I would very much like to see a bill passed, if it's possible, that no one in Congress takes a dime from these people, not one dime. They are ruining our country. They could care less about anything that has to do with what's good for the people of this country.
You've raised a very, very important issue, and it has to do not just with health care, not just with the cost of prescription drugs, not with the deregulation of Wall Street so that those crooks could lead us into a major recession. What we're talking about is the impact that big money has on the political process in Washington. And I think the caller is absolutely right. It is an extremely negative impact. And in my view, that is why we have to move toward public funding of elections. Candidates and incumbent members should not be dependent on big money interests, because I'm afraid that dependence leads to legislation which does not work for ordinary people. The gentleman talked about bankruptcies, and here's an interesting point. In 2007, 62% of bankruptcies, personal bankruptcies in this country, were related to medical bills. 62%. And the majority of those people had health insurance. So even if in many cases you have health insurance, if you have large deductibles, if your insurance policy doesn't cover all of your needs, you can go bankrupt, and large numbers of people are doing that.
John had emailed this question. Currently, healthcare is a regulatory and bureaucratic mess. How would government make this any better? How would a single-payer system and all the corporate cronyism that comes with it help?
Look, nothing is perfect, but this is what we got so far. You got a Veterans Administration. Does it have its problems? Sure it does. But I'm on the Veterans Committee, and what I can tell you is the veterans throughout this country, by and large, are very supportive of the VA system, which is run far more cost-effectively, by the way, than most other hospital and medical programs. You have Medicare. Does Medicare have problems? It sure does. But the administrative costs of Medicare are a fraction of what private health insurance costs are. It runs more smoothly. I think the goal that we have is to create a simplified system, because the complexity of the current system has to do with insurance companies, among other things, cherry picking, saying, we want to cover you because you've just run the marathon and you're 20 years of age and we're quite sure that you're not going to get sick. You're a good guy to cover. On the other hand, if you are 50 years of age and had a cancer operation, we really don't want to cover you at all because we're going to lose money on you. And it becomes a very complicated process to cover you, not cover them. What we have got to say as a nation, we're all in this together. We're all going to get coverage, and we're going to do that delivery system in the most cost-effective way. We're going to put more money into disease prevention. We're going to put more money into primary care. 60 million Americans today, 20% of our country, if you can believe it, do not have access to a doctor on a regular basis. What happens to those people? When they get sick, they either go to the emergency room at very expensive care, or they get sick and they end up in the hospital at outrageously expensive care. The nature of private insurance is not to address those needs, because many of those people don't have a whole lot of money. So we need a simplified system, we need a universal system, we need a comprehensive system. I believe we can do that.
Will Senator Baucus hold a hearing on the single-payer system?
What he indicated to the people that I met with him is that he apologized. He thought he should have done that. He wasn't 100% sure that at this stage in the process, probably too late for the Finance Committee. On the other hand, I'm on the Health Education Committee, which is the other committee dealing with this issue. I believe we will have a testimony, to the best of my knowledge, from single-payer advocates.
But who is leading the effort? With Senator Kennedy battling cancer, who is the point person on health care right now?
Senator Dodd is at this moment, I think, taking most of the, along with other senators. We are meeting, as I mentioned later on this morning, we're going to be going on for 3 or 4 hours just going down the bill. So, but Dodd, I think, has assumed the leadership.
Is Senator Baucus open to your ideas? He's not.
To a single-payer idea? No, not in a million years.
Does that bother you?
Well, it bothers me. It's not just Senator Baucus. It is every Republican. I mean, let's be clear.
But he's a Democrat.
Yeah, well, I'm an independent. And that's why I'm.
But you caucus with the Democrats.
I caucus. You know, look, what am I going to sit here and tell you the Democrats are perfect? They are immune from money pressure? Of course they're not. We have some wonderful Democrats who are fighting to do the right thing. But you have some conservative Democrats who will be working with the Republicans. Now, from a political point of view, let me say this. There is some people who say, well, we've got to move forward in a bipartisan approach, which means that we have to have cloture on a filibuster, which means you need 60 votes, which means that you have to make major compromises. My guess is and I may be wrong on this, but my strong feeling is if we end up with a bill that has 60 or 70 votes, it will be such a weak bill that it will not accomplish, I think, what the American people want. I would rather pass a strong bill with 51 votes than a weak bill with 65 or 70 votes. Bottom line is, the current system is dysfunctional. We're wasting $300, $400 billion, and we need to move toward a cost-effective, comprehensive, universal program. We have to finally move in that direction. This is a human right, and we have to have the courage to take on the drug companies and the insurance companies who just exert enormous power here in Washington.
Karen is a Republican joining us from Gradinger, Iowa. Good morning, Karen.
Good morning. I have a quick statement and another question.
Certainly.
The biggest problem we have in America is greed, and it goes all the way from the largest politician all the way down to the individual. That's what I believe. And no matter what system is put in place, greed will always find a loophole. And because people aren't honest and people don't care about other people, that's the problem. I raised kids on $1,500 a month, never went bankrupt, never had defaulted on a loan, and never had a health insurance. My ex-husband wouldn't pay for it, and I couldn't afford it. But you know what? I paid my bills, and I didn't buy brand new cars, and that's how I did it. So it is doable for the individual. But my question is what about putting a cap on how much these big CEOs can make and all different things? And also, as far as I'm looking for a politician who is willing, you know, people fought and died for this country. We don't even have a politician who is willing to sacrifice his job.
Well, let me start off with the first point that Karen made. She's right. I mean, we are in a moment in history, and we saw this from the people on Wall Street who were not content with making 30 or 40% rates of return. They had to make more. Not content as hedge fund managers with making $1 billion in personal gain. They apparently needed to make more. She's right. And greed permeates almost every aspect of her life. But I would say to Karen, who is, as I understand it, living with no health insurance because she doesn't have a whole lot of money, Karen, that's a dangerous position to be in because you never know what's going to happen tomorrow. You don't know what kind of illness can develop. You don't know what kind of accident your kid can have. So I think as a nation, we have got to move toward health care for all people. In terms of putting one's job on the line, I think there are people in Congress, perhaps a minority, who are prepared to stand up to the big money interest and take on the drug companies and the insurance companies. But I think Karen is right in the sense that there's just not enough.
We have a call, an email, and a tweet. This tweet from Daniel Yount, who says, my sister had cancer and went bankrupt because of it. 10 years later, she's had problem getting jobs because she had cancer.
Well, this is another issue. The bankruptcy we touched on. If you go to other countries around the world, people are going to criticize all the countries, but you asked how many people go bankrupt because of illness in Canada or in other countries, the answer in most cases is zero. It just doesn't happen. And second of all, we have millions of people today who are staying on their jobs. Do you know why they're staying on their jobs? Not because they want to stay on their jobs, not because they're content or happy on their jobs, because they have decent health insurance and they're afraid to leave their jobs to go to another job where the health insurance is not as good. Does that make any sense from a personal point of view or from an economic point of view? And the answer is it doesn't. So what we have got to do is move away from employer-based health care to national health care, which says if you are an American, no matter what your job is, you could be sweeping the streets, You can be the President of the United States. You're going to have the same quality, comprehensive health care.
This viewer from San Antonio saying, would you please clarify with Senator Sanders that the federal health care policy that they receive, referring to members of Congress, is seriously subsidized by tax dollars, unlike the comments of Congressman Gingrey, who, as you know, joined us before.
Two things about that. Number one, the program that I have as a senator is, to the best of my knowledge, the same as postal workers, the same as my secretary, the same as anybody who works for the federal government. So it's not like members of Congress have this different policy. Second of all, the caller is right. Like many other employer-based healthcare system, our healthcare system, the federal healthcare system, is of course subsidized by the government. Absolutely right.
Sandy, our last call from Casper, Wyoming, independent line for Independent Senator Bernie Sanders. Good morning.
Good morning. I just wanted to talk about, I'm not sure that national health care is the answer. I know we need something. I am a retired social worker. I just retired a little less than a year ago. 20 years in social work in nursing homes, hospital, assisted living, worked with Medicare, Medicaid, and the VA system. It's terrible. People have a terrible time with it, and the nursing homes, the doctor's offices, have to employ 2, 3, 4 people to try and get reimbursement from Medicare, to argue with Medicare and Medicaid on their bills. I worry that a national health care system run by the government, like Medicare, Medicaid, is going to be another problem like that. I think, I saw my doctor recently, my heart doctor. I saw him for 10 minutes. It cost me $92. That is part of the problem with health care. That's outrageous.
Can I take Sandy's point and move it ahead to one final question? You can respond to her situation, but also ultimately what you think Congress is going to vote on.
Well, what I would say to Sandy is I think if you talk to most physicians, they will tell you that dealing with the private insurance companies is a lot worse than dealing with the VA or Medicare, is my understanding. And in terms of Sandy paying $92, she's doing pretty well. I have heard horror stories where people walk into an emergency room for an hour or so and they come out with a $1,000 bill. And that deals with reimbursement rates, among other things. I think we, in many ways, are not putting enough money into primary health care. Too many doctors are going into specialty care, and that confluence of doctors and specialty care in many ways is driving up costs. It is an issue that we're looking at. What's going to happen? I don't see a crystal ball here. I think the situation today is significantly in flux. I think you got 2 committees in the Senate working on it. You got 2 committees in the House working on it. You got the president who's going to intervene. So I think we don't know at this point what's going to happen. But I would conclude by saying I hope that the American people get actively involved in this process. And I hope that they will demand that health care in America become a human right, that all of us have it regardless of income, and that we have a simple, comprehensive, high-quality system that guarantees health care to all people.
Senator Bernie Sanders.